Ladies and gentlemen, may I have your attention? The presentation is about what is depression. First of all, I would like to welcome all of you to this presentation. In this season, we would like to have a presentation on Zoom meeting. Well, a very good morning everyone. Welcome and thank you for tuning in. My name is Fiksi Pulnera Alvius. My metric now is J23A0725 and I am the moderator for this group. Before the presentation begins, let's get to know our panelists that will heat up our discussion today, shall we? The first panel that I would like to introduce is Sylvester Anak Herman. The second panel is Muhammad Nias Harith bin Muhammad Nazari. And the last but not least is our third panelist is Jack Liu Yi Hong. Without further ado, I would like to welcome the presenter to deliver the presentation. All right, depression is a disorder that afflicts over 10% of the world population, but we as a society know little about it. Stereotypes tell us that depressed people are weak unless they happen to be a total artist. It can be difficult to understand depression because it's invisible. It's a disorder defined by thought, behavior, feelings, rather than obvious symptoms like vomiting, cases of fever. Those who have experienced depression are all familiar with comments from misguided friends, snap out of it, or just get up and do something. Even those with depression might have a hard time understanding what they are experiencing, and they often blame themselves for not being able to snap out of it. So, in your opinion, can you explain what symptoms of depression? I would like to welcome the first panel, Sylvester, to express your point of view on this topic.
Okay, thank you, moderator. I'm Sylvester Anaanman. My number matrix is J23A0609. Okay, based on my opinion about the symptom of depression, among the most obvious and noticeable is persistent sadness or low mood. But it's referred to a intense feeling of sadness, emptiness, or unhappiness that persists for an extended period of time. A individual experiencing persistent sadness may feel overwhelmed by a sense of hopelessness, despair, or a general lack of interest in life. They may find it challenging to experience joy or pleasure, even in activity or situation that we used to bring happiness. This emotional state can be pervasive and affect various aspects of their life. Okay, it's important to note that occasional and feeling of sadness are normal part of life, and everyone experience them from time to time. However, in the case of depression, the sadness is persistent, lasting for weeks, months, or even longer, and can significantly impact to the person's quality life. Besides that, other symptom of depression is sleep disturbances. Not the only sleep disturbances, it including the insomnia, hypersomnia, and disrupted sleep pattern. It is difficulty falling asleep and stay asleep or waking up too early. Individuals with depression may experience racing thoughts, anxiety, or worry that makes it challenging to fall asleep. The relationship between depression and sleep disturbances is complex and bidirectional. Depression can cause the sleep disturbances, and sleep disturbances can worsen the symptoms of depression. That's all from me as a panel one. Thank you.
Wow, what a great point of panelist one. If there any panel would like to add anything,
Moderator, may I continue?
sure, panel two.
Thank you, moderator. My name is Muhammad Nias Harid bin Muhammad Nazri. My number metric cards is J23A0669. In my opinion, the symptoms of depression is physical pain. Physical pain caused by depression is very common. For example, you might visit an orthopedist for chronic back pain, but the cause can be found and painkillers simply might not work. However, if the patient gets diagnosed with depression by a psychiatrist, the pain might be start to disappear as the depression improves. Depression pain can occur anywhere throughout the body, from the head to the face, neck, shoulders, backs, limb, and pubic area. However, X-ray and blood tests of this pain won't reveal any abnormalities. As a result, the doctor might even tell you that it is all just your imagination. What's really happening is pain in the body is picked up by the amygdala, a part of the brain that becomes hypersensitive during depression. This might cause you the feel pain that is 10 or 100 times stronger than you would normally feel. Although no apparent no apparent abnormalities can be found at the location of the pain, the brain feels the pain regardless and is overreacting to it. Another symptom of depression is forgetfulness. Because of the decline in brain function, forgetfulness is common. You might not be able to recall people's names, or you might often forget important things in your car. You may even mistake if you dementia and hurry to a clinic that specialize in memory loss, where you might end up diagnosed with depression. When you suffer from the forgetfulness related to depression, you might be able to recall some forgotten things later on. Forgetfulness related to dementia also includes forgetting things, but they cannot recall things even when they are pointed out to them. In addition, dementia is also characterized by the fact the act of the forgetting things does not tend to be better those with the condition all that much. That's all for me. I hope my opinion is you guys can agree. That's all for me.
Sorry, may I interrupt, moderator?
Yes, sure.
Thank you, moderator. I would like to respond to their opinions. My name is Jack Liao Yi Hong. My metric number J23A0563. Loss of interest or pressure is a hallmark symptom of depression. That loss of interest or pressure in activities that were once sources of joy, hobbies, social engagement, and even personal relationships lose their allure, leaving individuals with a sense of emptiness and detachment. This withdrawal from previously enjoyment pursuit further deepens the emotional void associated with depression. Furthermore, change in sleep patterns and appetite also a symptom of depression. Depression can disrupt fundamental aspects of daily living, manifesting in change in sleep patterns and appetite. Insomnia, characterized by difficulty falling or staying asleep, or conversely, excessive sleeping becomes a common struggle. Similarly,
Fluctuation in appetite may result in significant weight loss organ exacerbating the physical toll of depression. In addition, social withdrawal depression can isolate individuals from their support networks, leading to social withdrawal. The desire for solitude often intensifies, and the once cherished company of friends and family becomes an overwhelming source of anxiety. Isolation in turn exacerbates feeling of loneliness, perpetuating the circle of depression. That's all for me. Thank you.
Impressive. That was a very good point from panel 1, opinion from panel 2 and 3. Alright, ladies and gentlemen, now we have come to question and answer season. All panelists, may I start the question and answer season?
Yeah,
Yes,
sure,
sure,
moderator.
moderator.
Panelist 1, in your opinion, what are the types of depression?
Okay, in my opinion about the type of depression, I have picked three types of depression from the Diagnostic and Statistical Manual of Mental Disorder, fifth edition. Firstly, the type of depression is major depressive disorder, MDD. It uh, involves persistent feeling of sadness or a lack of interest in activity, along with other symptoms such as change in appetite, sleep disturbances, fatigue, and feeling of worthlessness. Secondly, the persistent depressive disorder, dysymptomia, is type of involved chronic low-grade depression lasting for at least 2 years in adult. Lastly, the type of depression is psychotic depression. The type of severe depression is accompanied by psychosis, which may include delusion or hallucination. This I have picked from the manual. This some of the information I can give for my search about the type of depression. Thank you.
That is a great news from panel 1. I am sure our audience and panelists can see your strong point of regarding this point. Now let's take a moment to hear from panel 2 about does anxiety have anything to do with depression?
Thank you, moderator. In my opinion, anxiety may occur as a symptom of clinical depression. It's also common to have depression that triggered by an anxiety disorder such as generalized anxiety disorder, panic disorder, or separation disorders, clinical depression. Many people have diagnosed both anxiety disorder and clinical depression. Symptoms of both conditions usually improve with psychology counseling, medication such as antidepressant or both. Lifestyle change such as improving sleep habits, increasing social support, using stress reduction techniques, or getting regular exercise also may help. If you have other condition, avoid alcohol, smoking, and recreational drugs. They can make both conditions worse and interfere with treatment. I hope I already answer your questions. That's all for me.
Wow, that's a great answer from panel 2. Letting me to tell panel 3, in your opinion, how to recover from depression?
Thank you, moderator, for giving me the opportunity to answer this question. In my opinion, antidepressants are medications commonly used to treat depression. They work by changing how the brain produces or uses certain chemicals involved in mood or stress. You may need to try several different antidepressants before finding the one that improves your symptoms and has manageable side effects. A medication that has helped you or a close family member in the past will often be considered first. Antidepressants takes time, usually 4 until 8 weeks, to work, and problems with sleep, appetite, and concentration often improve before mood lifts. It is important to give a medication a chance to work before deciding whether it's the right one for you. Moreover, several types of psychotherapy can help people with depression by teaching them new ways of thinking and behaving and how to change habits that contribute to depression. Evidence-based approach to treating depression include cognitive behavioral therapy and interpersonal therapy. The growth of telehealth or for mental health service, which offer an alternative to in-person therapy, has made it easier and more convenient for people to access care in some cases. For people who may have been hesitant to look for mental health care in the past, telemental health service might be an easier first step than traditional mental health service. That's all for me. Thank you.
Wow, what a great point, panelist 3. I totally agree with your opinion. Thank you so much, panelists, for the informative and interesting talk. Finally, we come to end our discussion. Now that we have listened to all of the interesting points voiced by our panelists, there are so many inputs and information that can be seen from this topic. It opened our minds and eyes to take care of oneself from depression. Hence, everyone has the freedom to express their opinion on one of the famous topics. Nowadays, I would like to close the forum by thanking all of those panelists for their informative and interesting opinion. I would like us also like to thank audience for the active participation. Me as a moderator shall conclude to the today forum discussion. Thank you.